Good morning. My name is Andrew Nigan. Can you say your name for the record, please?
Good morning, my name is Rick Grimes.
And what is your candidate number, please?
My candidate number is 250024698.
Thank you. And you are taking this test as a nurse. Is that correct?
Correct.
Thank you. Can I see your ID, please?
Sure.
The warm-up questions are not assessed as a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes. Tell me about the time you stepped into a leadership role.
I have acted as charge nurse numerous times in my career. I have had to lead code teams, respond to rapid responses, and make difficult staffing decisions. As a charge nurse, I have determined patient assignments to ensure that assignments are fair and equal. Furthermore, I have to ensure that the nurse's skill set is sufficient for the assignment.
Give an example of a time you explained medical terminology to someone who is not medically trained.
It is imperative that we use simple words to our patients and families who are not medically trained and utilize a teach-back method to ensure they understand the information that is communicated to them. I once had to explain post-operative care to a family whose child had tonsil surgery. I had to use words such as poop instead of bowel movement. I used Tylenol instead of acetaminophen.
Describe a time you were faced with a patient who chose not to communicate or disclose important information.
A parent once didn't disclose that the father of the child was not her current boyfriend. This was important as the patient was going to need consent forms signed, and legally, this boyfriend was not able to sign the consent forms. Additionally, there was a man calling the unit claiming to be the father of the child. Social work and the nurse manager were notified. Through an open conversation, the mother disclosed the correct identity of the father. While I personally did not discover the information, it is essential to know the resources that are available to you and utilize them to the best of your ability.
Give an example of a mistake you've made. How did you handle it?
Mistakes are part of nursing, whether we like to admit to it or not. It's important to learn from those mistakes and become a better nurse. One mistake that I will never forget is leaving the gastrostomy tube unclamped with medication administration. Because it was unclamped when I opened the port to give the next medication, the last medication, as well as formula, came out. I was unable to clamp it quickly enough, and the medications I had already given were leaking onto the bed. I had to speak with the medical team and pharmacy to discuss replacing them. I have never forgotten to clamp the gastrostomy tube again.
What do you find most difficult about being a nurse? How do you overcome this difficulty?
The most difficult aspect of being a nurse is watching a patient die, especially one that I have cared for when they were healthy. Watching the family lose a loved one is heartbreaking. Sometimes I sit in the bathroom and take a moment for myself to cry, to reflect, and to pause to remember the patient. Death is part of our everyday world, and sometimes that is hard to remember.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play, please?
Good morning. My name is Rick Grimes, and I will be your attending nurse today. How may I address you?
Good morning, myself Andrew Nigan. You can call me Nigan.
Hi Nigan, I can see you seem frustrated. Could you tell me what is bothering you?
Yes, I am really stressed. I have been suffering from frequent multiple white ulcerations in my mouth.
Alright, I can understand that it is quite difficult for you. Isn't it?
Yes, it is. I am a person who speaks a lot. But now because of these ulcers, I am not even able to interact well with my family and friends. Moreover, I can't eat and swallow well because of these ulcers.
I am sorry to hear that. Mouth ulcers are a very common condition among many people. If you don't mind, may I ask you some personal questions?
Sure.
When did you first notice the lesion?
I really don't remember exactly when it was. But if my memory is good enough, I believe that it was before 8 to 9 months.
Alright, how frequently are you getting this?
Nearly 3 to 4 times in a month, and it will persist for around 2 to 3 days.
Have you noticed a change in the shape, size, or color of the lesion?
Not really. From the beginning, it is white in color.
Do you have any habits of smoking or drinking?
No, I don't.
Okay. Then there's nothing to be alarmed about it.
Thank God. Could you please explain to me the cause of these ulcers?
Yes, I am glad to explain it to you. These are recurring ulcers, with no known causes, that affect around 20% of the population. Even though there are some major causes.
Yes, I really want to know the causes of this, so that I can avoid those.
Alright, it might be because of an accidental biting, or an injury from a toothbrush. Poor oral hygiene, burns from eating hot food, irritation from strong antiseptics, such as a mouthwash, reaction to certain medications, or skin rashes in the mouth. Am I clear to you?
Yes, but I am a person who follows good oral hygiene.
Alright. So the cause of your ulcer might be something else from the list, or sometimes unknown. Do you get my point?
Alright, I have another question for you.
Yes, you may proceed.
Are these mouth ulcers hereditary?
It may also be partly genetic, with 40% of people who experience ulcers having a family history of the condition. However, we cannot confirm that it is. Alright. By the way, do you have any other medical conditions?
Oh. No, I'm quite healthy.
Great to hear that.
Alright, nurse. It would greatly be appreciated if you could provide me with some remedies for these mouth ulcers.
Sure, there are a few methods that can be followed in order to prevent mouth ulcers, such as brushing teeth gently, eating a well-balanced and nutritious diet, and drinking plenty of water a day. Is that clear for you?
Yeah, I understood. Is there anything else that needed to be taken as a treatment?
Yes, you should avoid spicy and sour foods until the ulcers heal. Regularly rinse your mouth out with warm and slightly salted water. Keep your mouth clean, and try to use an alcohol-free medicated mouthwash.
Okay.
In addition to this, the doctor can provide you with some antiseptic gel, a topical steroid mouthwash, or ointment, and pain-relieving medications. Is that okay with you?
Great. Hope I will get a complete cure from this hectic ulcers.
Yes, if you follow all the suggestions well, I hope that you will get a speedy recovery.
The conversation was very healthy, thank you.
Alright, do you have any other concerns to be resolved?
No. Not for now, thank you.
You are welcome. Get well soon.
That's the end of your speaking role play. Thank you.
Thank you, sir.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.